Hi, Lenore here with Medicare Plan Discounts. Are you turning 65 and about to enroll in Medicare for the first time? If the answer is yes, then this message is for you. Stay tuned in Day 7 of our mini-series, Medicare, the Inside Scoop. I'm going to share with you 10 common Medicare pitfalls and how to avoid them. Today I'm going to share with you 10 common Medicare pitfalls and how to avoid them. Remember to visit us at MedicarePlanDiscounts.com and subscribe to our YouTube channel in the lower right corner. Also feel free to like, comment, or share if you receive value from this video. So let's get started. Common Medicare pitfalls, Q&As. Medicare is confusing. We get it. Don't get caught in these common Medicare pitfalls. So pitfall number 1 is not preparing for the cost of Medicare and thinking that Medicare is free. Now, when you're ready to retire, you need to factor in that Medicare has a monthly premium associated with it, and no matter what type of plan you have in retirement, that cost for Medicare Premium Part B will stay with you for as long as you're on Medicare. Now, Medicare Part A does not typically have a premium if you or your spouse has worked 40 quarters or 10 years. Part B in 2017 starts at $134 a month, and if you're a higher income earner, you will pay more for Part B premium. Pitfall number 2 is thinking that Medicare covers everything. Again, you need to factor in these costs. Deductibles, copays, and coinsurance are not included in traditional Medicare, and there's no out-of-pocket maximums. Typically, Medicare covers about 80% of your expenses, and you're on the hook for 20%. Additionally, things like standard dental, hearing aids, durable medical equipment, and glasses are not covered under traditional Medicare. That's why most folks pick up a Medigap plan, a prescription drug plan, as well as a Medicare Advantage plan. They pick up one or the other. So pitfall number 3 is not knowing when to enroll. This is really important. Medicare has some very specific enrollment time frames. Typically, you'll enroll when you first turn 65 or when you're coming off of a group plan. But if you don't enroll at the right time, you could have penalties that will carry forward with you for as long as you're on Medicare, which is basically the rest of your life. Pitfall number 4 ties in with pitfall number 3, is thinking that someone will tell you when it's time to enroll. Now, clearly you don't want to be in late enrolling for Medicare, but that doesn't mean you'll be notified by the program when it comes time to enroll. If you've chosen to enroll in Social Security benefits before turning 65, chances are you will be automatically enrolled in A and B, but you still need to pick up Part D. Now, if you're not collecting a Social Security benefit, you need to proactively enroll in Medicare. Thinking that everyone pays the same for Medicare is pitfall number 5. Now, as I said before, if you work 10 years or 40 quarters, you're typically not paying for Medicare Part A. But if you haven't paid into the system, Part A is going to cost you $411 a month. In addition, if you're a high income earner, those earning over $85,000 as a single or $170,000 as a married couple will pay a surcharge not only for Medicare Part B but for Medicare Part D. And if you choose to pick up a Medicare Advantage plan, you still will have that surcharge added onto your premium. So those who enroll in Medicare Part B and D late as well will pay a penalty for life under Medicare. So not everybody's going to be paying the same under Medicare. Pitfall number 6 is thinking that your health will stay the same. You do not know how many times I hear from people thinking that they're going to save money on the front end by enrolling in a lower premium plan and not taking into account that 10 years from now they may need a more comprehensive plan. So the other thing that people don't take into account is that if they're not taking prescription medications now, they may be taking them later and they think, oh, I don't need a script plan. or I can enroll in this kind of plan now and change later. Well, that's not always the case, and you want to make sure you're thinking ahead as opposed to when you actually enroll in Medicare. So pitfall number 7 is not understanding how other insurance works with Medicare. Now, a lot of folks out there will have additional health insurance outside of traditional Medicare. You may be enrolled in an employer group health plan, you may have a retiree medical plan, or your spouse may have one. Maybe you have coverage through the VA, known as Tricare, and there are rules that decide whether Medicare or your other insurance pays first. So you really need to do a little bit of homework to figure out how these plans work with Medicare. Pitfall number 8 is not working with the right agent. Now, it's a good idea to work with an agent, but not any agent will do. So you might be getting phone calls from large call centers, companies that can only enroll you in their plan. That's not the right agent. The right agent is someone who has access to more than one plan design and more than one insurance company, so they can help you figure out the right plan for you with the right company. And keep in mind that this does not cost you anything extra. It will most likely save you time and money. Pitfall number 9 is not reviewing your prescription drug plan every year. So even though nothing has changed with your medications, the actual plans themselves may change, and every year Medicare allows you to change your prescription drug plan, and you should really go to medicare.gov or work with your agent to figure out if you're enrolled in the right prescription drug plan. That will save you money in premium as well in costs when you go to get the script filled. Pitfall number 10 is very important. Getting advice from your family and friends, I know their intentions are good, but sometimes following their advice isn't always the best way to enroll in Medicare. So they typically don't know your circumstances, they don't know the market, they don't know the different insurance companies, and Medicare itself does change over time. So the plans that were available to your parents may not be available to you at this given time. So it's a good idea to work with a reliable professional from the Social Security and Medicare office. So you can give a call or go down to the local office and talk to someone about Medicare and Social Security for you specifically. Then the state office does have free volunteers who can help you. They are not biased people, okay? So they typically have a senior center or a state office that will help you. And then again, we strongly recommend working with a licensed insured professional, someone who works with a lot of different companies. Now, you can still talk with your family and friends, and you definitely should, but you need to make sure you're getting the whole picture from the other reliable sources out there. So if you still have questions, and I know there are a lot of things that are specific to you because everyone is different, we encourage you to give us a call. A licensed insured professional at Medicare Plan Discounts is ready to take your call. Our number is 844-280-0785.
Hi, Lenore here with Medicare Plan Discounts. You made it. You finished our 7-part Medicare mini-series, Medicare The Inside Scoop. Congratulations, you're ready to get started. Give us a call at 1-844-280-0785, where a licensed professional at Medicare Plan Discounts is ready to help you. What are you waiting for? One call will give you peace of mind and confidence that you're making the right choices for Medicare. Thank you.